But then going to maybe phobias that children especially experience in their young ages and the adolescent ages. So Professor Hemamali, if you could just tell us about some of the phobias.
Yes, phobias in children are a bit different to what Dr. Mahesh was just describing. Now I think phobias in children should not be mixed up with fears that lots of children show about the dark or thunder, lightning when it's sort of overcast and it's about to rain.
Everyone has been scared of monsters under their bed.
That's right, yes. That might be triggered by watching something on television or little creepy crawlies, right? Because they are often passing phases in children's development, so you wouldn't pay too much attention. But take a child who gets up in the morning on a school day, complains of tummy ache and may even start vomiting, and then taken to the doctor and find there is nothing really physically wrong with the child. It goes on and it reveals in the end the child anticipates something unpleasant happening in school, and therefore this is a way that would help the child to avoid going to school.
I see.
Now that's a phobia because it disrupts the child's daily routines. There is this intense fear about going to school. There is this anticipation that something catastrophic or something that is very difficult would happen, and therefore there is this avoidance. So that's in fact is a phobia very specific to children, of course, because they attend school. And the reason behind that could be the child is scared of the teacher or has got bullied and now expect another episode of bullying to happen in school, or has found lessons too demanding and therefore that's provoking a lot of anxiety, or it could be an exam on that day, or it could even go further, like say the school van was a bit delayed and now the thought is that I might be left behind in school, I'll never be able to get back home.
Oh, I see.
Or sometimes you find that it's not the school at all, but home where a parent may be sick. So the child is scared of leaving the parent in case something really catastrophic happens, and when the child comes back from school might find the parent gone or hospitalized or something worse than that. So there is a whole now just refusal to go to school and the phobia about school. There could be a range of reasons for that, which you need to try and understand.
All right.
Yes.
So I think we'll be going back into the signs and physical symptoms as well as the emotional symptoms that people show when they have phobias. But right now we have to go for a short commercial break. But do stay with us here on Good Morning Sri Lanka. We'll be right back. Good morning Sri Lanka. Now if you missed the first segment, we've been speaking today to an expert panel about phobias and how you can really identify if you have a phobia or just a fear of something, and we'll be speaking later on during the show about how you can address these phobias and really get over this to lead a normal, healthy, happy life. Alright, so we were speaking earlier about a general definition of what a phobia is, but what are the specific, let's say, physical symptoms of someone who has a phobia?
Right, now the first physical symptom that is very common is increase in heart rate or palpitations. So your heart starts to race and then breathing increases. You tend to breathe faster. You might have a tightness or a chest pain kind of thing in your chest. Another physical symptom is sweating.
I see.
You tend to sweat, sometimes the palms, you sweat on your palms, you feel sweating at the back of your spine, and another thing is you definitely feel something in your stomach, you know, or the intestines, a kind of what they call butterflies in your stomach sometimes. People sometimes start to shake a bit physically. They have a tremor, and you have butterflies in your knees. Sometimes your knees starts to tremble, especially when you have public speaking phobia. That's very common. And people can have even physical symptoms such as difficulties in talking, like stammering or shuddering and things like that. Those are the most common physical symptoms.
Okay. So before we go on to the emotional symptoms that are apparent in the patients with phobia, we have a small video clip that's ready about how you can overcome any type of fear in general. So let's check it out and get back to our discussion.
How to overcome any fear. Whether it's heights, flying, or public speaking, a profound fear can compromise the quality of your life. Don't live with yours another minute. You will need a journal, notebook, or paper, foods high in tryptophan, orange juice, and soothing essential oils. Step 1. Write down exactly what you're afraid of and why. Research shows that putting your fear in writing can be empowering, giving you more confidence and helping you realize that some things you're worried about are plain ridiculous. Step 2. Pick an encouraging mantra like, "I can handle this," or "Nothing can harm me," and repeat it in your head whenever you have to do something that scares you. Psychologists say this instills courage. Step 3. The next time you have to do something scary, make a fist. Hold it for 10 seconds, then release. Sounds silly, but this reduces fear by relaxing muscle tension. Step 4. Eat more turkey, cheese, and nuts. They all contain tryptophan, an amino acid that helps people feel less anxious. Drink a big glass of orange juice before you have to face any fear. Vitamin C lowers stress hormones in as little as 15 minutes. Step 5. Use soothing essential oils. Available in health food stores, they have been used to battle stage fright, face frightening medical procedures, and deal with trauma. According to the directions, put a few drops on your wrist or under your tongue until you feel calmer. Step 6. Face your fear. Again and again and again. Research shows that repeatedly confronting your fear can suppress your fright response. In fact, experts say up to 90% of phobics can overcome a specific fear with this technique, known as exposure therapy. Step 7. Ask your doctor about medications that have shown promise in reducing fear when a person is faced with the scary situation.
So all these were good tips, were they? I'm asking you. Dr. Mahesh?
Yes. Now, as psychiatrists and scientists, what we prescribe or recommend is interventions which have been shown to be effective. They might sound interesting, or you might think that it might really work. But when you look at the research that has been done and what scientists have found, most of these, so what they have found is that most of remedies suggested like these may work, but the actual active ingredient in them, in most of the time, is the one particular step that they named exposure.
I see.
That is the one that really works. Exposure is, so you have intense anxiety in relation to a specific condition. Say, for an example, cockroaches. So when you see a cockroach, you have intense anxiety. So you go on interacting with cockroaches, maybe pictures, or you go into a room where there are cockroaches, and then the anxiety gets worse. So that is what is called exposure. You get exposed to anxiety. So if your fear, your anxiety, the physical symptoms that we just described get worse. But no phobia has ever killed a person. So what happens, after a while the anxiety starts coming down. And when that happens, the next time you are exposed to that same condition, say for an example cockroaches, the anxiety is less now than the previous. So you do it several X number of times, your anxiety is less and less and less.
I see. So that last step is really the one that works, and it's the one that you would prescribe. But again, it's always best to seek proper medical attention before you try anything yourself. But that's good to know that exposure is the key to everything. But if we're going to, we'll come back to how you can treat phobias a bit later, but if you go into the emotional symptoms of someone who is undergoing this condition known as phobia, what would you see in that type of person? Emotionally, what would they be undergoing? Professor Hemali?
Yes. I think the anxiety shows up as lot of apprehension. It's so tension, and it shows up in their facial expression. So that's what is apparent. And some people may be able to hide it very very well, and the emotions may not show up, especially if they quickly leave the situation and hide themselves or something like that. Nobody would actually discover. Say for instance, well, now I'm talking about an adult, say a bank clerk with or at the counter with social phobia and phobia for facing customers, might quickly get up and leave his seat, so you'll never discover how anxious he is. But it's a sense of apprehension that you see in that. The difficulty in talking, they might show up, might be apparent to the other people. It's the difficulty, or it's highly unlikely, sort of huge sense of fear, as if you've seen a ghost or something like that, would be very obvious to other people. But in case of children, if I may say that, the emotions show up very well because they can't hide their emotions, so they are terrified of the, say, if they are pushed to go to school or something like that, they might be crying. So a lot of huge temper tantrums, not temper so much, but tantrums at the school gate.
I see.
Would be because of school phobia for attending school, or a child clinging to the mother and not leaving, not letting her go, maybe, and sometimes even anger and kind of throwing things or trying to hit or screaming, and all that would be the intense expression of intense fear the child feels because of the anxiety.
But if exposure is the key to overcoming phobia, then what should a parent do at that point? Always try to push their child into walking into the school and leaving them for extended amounts of time?